It's a beautiful spring day, and all you want to do is to walk somewhere with fresh air. You stayed too much inside with this prolonged winter and COVID-19 quarantine. But after a short period of time, you feel something is wrong with you, and a powerful headache appears. How can that be on such a beautiful day with great weather? Could it be your autoimmune disease causing it? Or maybe some infection? Keep watching if you want to know more about headaches. If you are new to my channel, my name is Andrea from Flagship Medicine, and I'm a physician with a persistent dream to bring new insights into various medical topics going beyond the obvious. If you want to be updated with highly researched medical subjects, be sure to subscribe and click the bell icon, and let's do this together. The autoimmune disease that I will cover today is systemic lupus erythematosus, for short SLE, a heterogeneous autoimmune disease with unique characteristics affecting every major organ in the body. As a SLE patient, you can experience constitutional symptoms like fever, adenopathy, chronic fatigue, mucocutaneous, acute, subacute, or chronic lesions, neuropsychiatric from mild symptoms like headaches, mood disorders, to more life-threatening ones like strokes and myelopathies, lung and heart problems. It is well known that SLE affects all layers of the lungs and heart, renal involvement, lupus nephritis being a major cause of death, gastrointestinal involvement with mesenteric vasculitis, ascites, musculoskeletal problems with arthritis and myositis, pregnancy complications. SLE is the musculoskeletal autoimmune disease with the highest risk for maternal and child death, preterm birth and fetal complication, immunologic, hematologic, and so on. From the myriad of clinical manifestations of the disease, I choose to talk about neuropsychiatric involvement, more precisely about headaches. EULAR guideline on recommendations for the management of systemic lupus erythematosus with neuropsychiatric manifestations from 2011 states that if we exclude other life-threatening causes of headaches like meningitis, sinus thrombosis, cerebral or subarachnoid hemorrhage, headache alone requires no further investigation beyond the usual evaluation that would have been performed for non-SLE patients. ACR described lupus headaches in 1999 as a severe persistent headache which may be migraneous but unresponsive to narcotic analgesia. This definition is included also in the Systemic Lupus Erythematosus Disease Activity Index 2000, or for short SLEDAI. For the differential diagnosis, we are advised to use the International Classification of Headache Disorders, elaborated by Headache Classification Committee of the International Headache Society, a document of 200 pages that contain only diagnostic criteria. This can cause the doctor a terrible headache. I can confirm. Joking aside, this manifestation has been extensively studied in SLE patients. The unanimous conclusion from the studies is that the prevalence of all headache types does not differ between SLE patients and the general population, but indeed they are associated with greater disease damage, higher disability, and reduced cerebral gray matter volume when compared to SLE patients without headache. Maybe the most important part of the video relies on the question, when should you contact your doctor? First of all, if your headache is unresponsive to symptomatic medication like analgesics, please be careful with NSAIDs, especially ibuprofen, because it can cause a septic meningitis to systemic lupus erythematosus patients. Secondly, you should contact your doctor if you have other symptoms that suggest disease activity like fever, fatigue, adenopathy, weight loss, acute cutaneous lesions, or other acute symptoms related to lungs, heart, kidneys, or gastrointestinal tract, especially if you have switched to another therapy or lowered your corticosteroid use. You should contact your doctor immediately if you have muscle weakness in one arm or leg, or if you don't feel touch symmetrically on your body. If your blood pressure is too low or too high, be careful here if the blood pressure changes with position. If you have photophobia or neck stiffness. If you are a person with frequent migraine type of headache, be careful with your diet. Some foods can trigger migraines. It is recommended to avoid food that contains a lot of preservatives, yeast, flavorings, and nitrates. The internet is full of information of this kind. Still, a systematic literature review conducted by a team of scientists from Stanford University and Eli Lilly and Company in 2020 that included 43 studies from year 2000 to 2019 concluded that, and I quote, "There is limited high-quality randomized controlled trial data on diet patterns or diet-related triggers. Although many patients already reported avoiding personal diet-related triggers in their migraine management, high-quality research is needed to confirm the effect of diet in people with migraine." I will put a link for the full article in the description box below. Treatment for headaches should be made according to the exact etiology. This is why a proper diagnosis should be made as soon as possible. Please leave me a comment below with your most frequent type of headache and how you managed it. Thank you very much for watching. See you soon!